Babbitt. I'm a clinical psychologist and director of behavioral health services here at Western Wisconsin Health. Welcome to the Living Green Wellness Series. Today I'm going to be talking about ADHD, or Attention Deficit Hyperactivity Disorder. Some people these days are a little bit confused about the use of ADHD because we've been so used to talking about it as ADD. For various reasons, the people that put together the diagnostic manuals that we all have to use decided a few years ago that we would now refer to all forms of ADD as ADHD. And of course, ADHD stands for Attention Deficit Hyperactivity Disorder, and the confusion comes from some kids that are not hyperactive but still get that label. So I briefly wanted to explain that in case some of you were wondering where ADD went. But these days there are three forms of ADHD. The first one is ADHD primarily inattentive type, and that is really the old ADD. The second type is ADHD primarily hyperactive impulsive type, and that's kind of the classic hyperactive child that we've all heard various stories about, or perhaps live with, depending on what your family is like these days. And the third kind is ADHD combined type, which includes both the inattentive disorder as well as the hyperactive impulsive. So important to talk a little bit about that so people aren't confused about the fact that I'm referring always to ADHD. ADHD has been around for a long time. We've known about it for probably 50 or 60 years, if not more. And in the early days, it was referred to as a hyperkinetic disorder. Some people called it hyperkinesis. And without getting into all the medical terminology, what that basically meant was a child who was really more or less unable to sit still. The kind of classic stereotype we hear about is a child in the classroom, for example, who is bouncing off the walls, so to speak. A child who really cannot sit at their desk and learn very effectively. But what we've learned over the years is that it's a lot more complicated than just a child that may have difficulty sitting still. What we know these days is that oftentimes ADHD is not an obvious thing. In particular, we've learned that with boys, for example, they tend to be diagnosed more with the hyperactive type. Boys tend to be those kids in class that act up in a behavioral way and therefore get the teacher's attention. But we know that there are a lot of kids, and most girls are this way, who are primarily inattentive, and so they're a little bit harder to notice in a classroom setting. These are the kids who seem to be paying attention at one time, and then the next moment are not. And those are kids that are harder for us to understand. Here at Western Wisconsin Health, what we're working very hard to do is to develop a system to diagnose ADHD very carefully, because a proper diagnosis is really the key to the entire process of helping your child with that particular issue. Unfortunately, we've been through a period in probably the last 10 years or more where we probably have diagnosed ADHD a little more often than we should have. That's been a criticism that's been leveled not just against folks in the mental health profession, but in the medical profession. And for various reasons, teachers have also come under scrutiny for tending to see more kids than perhaps they should have as having ADHD. But these days we understand it in a way that we never have been able to before. And for example, one of the things we now can do is do a brain scan, for example, of a child, and we can actually see ADHD now in a way that we couldn't before. That's been a revolution in the process of diagnosing children. Now, for various reasons, most facilities don't have the kind of brain imaging technology that it takes to do that particular work. I think someday all of us will have that particular technology, but at the moment we don't yet. There are only a few institutions nationwide that are really doing that pioneering work. But it's nonetheless a fascinating thing to be able to look at a picture of your child's brain and see, if you will, the ADHD that's there. We've known for a long time that the symptoms of ADHD appear to be based in what are called the frontal lobes of the brain. And very simply, the frontal lobes are located essentially behind your forehead, for lack of a more technical way to talk about that. And we know that those areas of the brain are primarily involved in what we call executive functions. And executive functions are things like problem solving, organization, things of that kind, things that all of us really have to have in order to run our lives effectively. And in children that have ADHD, not only is that part of the brain underdeveloped, simply because they're not old enough yet to have it fully developed, but we know that that part of the brain doesn't function very well. And thus the interest in ADHD children being treated with medication as one potential intervention, because we know their brains are not functioning at capacity. One of the things that you'll hear from child psychiatrists, for example, is that when the medication works well, their brains are fully online. So they have access to all the things that other so-called normal children have, in the sense of being able to access all the parts of their brain that are essential for good learning and for functioning in society. But there's no question that ADHD, for various reasons, continues to be a little bit controversial. There are still people out there that aren't even sure it exists, despite all of the science that we now have that indicates that indeed it does. ADHD is a real thing. But I think as a profession, we haven't always done a great job of explaining what it is, of explaining how we evaluate and assess for ADHD, and then in particular explaining why it's often very important to use the proper medication with these kids to help them function at their best. Medication is always controversial whenever we talk about using it with children, and that's as it should be. We should be cautious about using medication with kids. But what I've learned over the course of more than 30 years of clinical practice is that the stimulant medications that are used these days to treat ADHD in children are very safe. I was thinking the other day about whether or not I've ever had a case where a child has had a very negative response to the medication that they've been given. And quite honestly, I can think of only a handful out of hundreds of such cases that I've worked on over the years where the medication hasn't been helpful or has created side effects. For the most part, the medication has been very effective if the diagnosis is correct. And again, that kind of gets us back to how important it is to be sure that what you're looking at is really ADHD and not something else. And I'll talk a little bit more about that in a minute. But medication, when it's used properly, allows children to focus and to function. And very often, for me, the best evidence that the medication is working comes directly from the child. Many times we've started a child on a low dose of medication, and when they get home from school, within the first few days that they're taking it, the child will announce that they had a great day at school. The child will tell you that they were able to get their math project done, or they were able to read that book that they needed to. And there's such a sense of accomplishment in these kids when they begin to function well. Because for many of them, school has really been exceedingly difficult. One of the problems that we sometimes see in kids with ADHD is that they're also a little bit depressed, because being in school is just hard. Every day is a challenge for them, and they look around the room and they see their peers who appear to be doing very well, and yet they continue to struggle and have difficulty. So when the right treatment is involved, we see kids really turn around very quickly. Another reason why medication, in my opinion at least, is so important in these particular cases is that it works very quickly and it moves out of your system very quickly as well. So for example, if you give a single dose of a stimulant medication to a child in the morning, let's say at 7 o'clock, by the end of the school day, that medication is out of their system completely. So if we were to do a blood test or a urinalysis, we would not find any sign of the medication in their system. That's very different than, say, an antidepressant medication, which has to build up in your system over a period of time and is not so easy to come off of. Stimulant medication can be taken during the week and not on the weekends, or it can be taken throughout the school year and not over the summer months. So in my experience, the medication's been awfully effective and a real godsend for many of these kids. But I want to circle back for a minute to the diagnostic process. We want to be very sure before we make any recommendations about what to do regarding an ADHD child that we have the diagnosis done correctly. And so here at Western Wisconsin Health, we work very hard to do that job right. And essentially what that entails is, initially at least, asking parents and teachers to fill out a large number of questionnaires. Teachers are used to doing that. They probably get several such requests in any given year, but parents are often a little bit daunted by several pages of questionnaires that we ask them to do. But that information is so important for us in terms of making our decision, because obviously as parents, you're with your child way more often than we will ever be. And in some cases, teachers are with your child longer than you are, at least during waking hours. And so all of that information is exceedingly important. And in addition to trying to figure out whether your child has ADHD, we also want to be sure what they don't have. So part of the evaluation process is making sure that there aren't other issues involved that might look like ADHD but really aren't. An example of that would be a child that has an anxiety disorder, for example, a child who's very nervous and anxious and jittery. Those children often look very distracted in a classroom setting, and therefore they are mistakenly, at least at times, diagnosed with ADHD when they really don't have that disorder. So we want to know, like I said, what your child does not have in addition to what he or she does have. And so on top of the questionnaires, we obviously spend time with your child and with you to get to know you a little bit, to understand the context in which the child is living, both at home and outside of home. And we also want to know whatever we can learn about their medical situation. Happily, most of the children that I've worked with over the years have not had co-occurring medical problems, but on occasion they do. And those are things that we need to be very, very clear about that as we do the evaluation process. One of the things that we do if we think we may be looking at an ADHD child after the questionnaires are done is we use a computer-based test called the TOVA. And TOVA is short for Test of Variables of Attention. But the TOVA is something we've used for a long, long time, and it's a remarkable test that is essentially what's called a continuous performance test. And what that means is that the computer is taking measurements about the child's performance continuously over the span of about 22 minutes or so. We get an extraordinary amount of data from that test that tells us about the child's ability to maintain concentration and focus over a relatively short period of time. One of the things that the TOVA has taught us, which is an interesting point here I'd like to make, is that even though we still refer to ADHD as an attention-based problem, that is probably not very accurate anymore. We know that ADHD is a more complex issue than just a child's difficulty paying attention. Part of that is that we know there are many reasons why kids might struggle to pay attention, such as the anxiety disorder that I mentioned a minute ago. But even a child who comes to school hungry, or a child who's had a fight with a sibling before the school day started, or something difficult has happened on the school bus, might come into the classroom and struggle to be attentive and focused. So what the TOVA has helped us to understand better is that probably attention deficit hyperactivity disorder is really a problem with attention that waxes and wanes. So these are kids who may appear to be paying attention one moment and the next moment they're not. And then they're back again, and then they're kind of there, and then they're gone. So we have a real shifting level of attention that happens constantly. So it's not as simple as being on task or off task. These are kids who are on and off constantly. And you can try to imagine what that must be like for a child who's trying to pay attention in class and who just can't maintain that focus for very long at all. And the TOBA test shows us that. So we can see that in minute 3, the child is engaged and involved, but in minute 4 isn't. And in minute 5 seems to be back again. So it's really a situation of kids moving back and forth on that spectrum of attention rather than just being on or off. So ADHD is a complicated thing, but we're learning an awful lot about how to treat it. One of the things that's happened in recent years, for example, is that more and more adults have come forward asking questions about whether or not they might actually have ADHD. And historically, we never thought adults had it. We really thought that ADHD was just a childhood problem. But again, as we've learned more over the years, we've found that many adults who probably had ADHD as children and were never diagnosed or treated for it are now, as adults, really struggling with doing things like keeping jobs, getting through college, or other training programs that they need for work. Sometimes these adults struggle in their relationships because they just aren't fully engaged. They often seem to be kind of half involved and half not because they're uninterested in their spouse or their partner, but because paying attention during a conversation or doing activities together is so hard for them. So we've seen more and more adults coming into the clinic here over the years who are trying to figure out why they're struggling as much as they are. And very often we find, when we dive into history, that these are adults who probably had ADHD as children and weren't treated for it, unfortunately. But there's hope for adults as well, because they often respond, interestingly, to the same medication that helps kids. So in a nutshell, what we're trying to do here in the Behavioral Health Service here at Western Wisconsin Health is to try to do, first of all, the best job of diagnosing your child that we can possibly do. And in my opinion, at least, there are a lot of places in Western Wisconsin where you probably could get some kind of an assessment for an ADHD potential problem. But I don't think, in all honesty, you're going to get a more thorough evaluation anywhere than you will here. We're a very experienced group with ADHD. We've been around a long time. We know what this looks like. We know how to tell what it is and what it isn't. And if the diagnosis is done correctly, then the treatment process follows a little bit more easily and usually works much better. We have a full team of professionals who've worked together for a long time. We have 2 psychologists, and we have 5 master's level clinicians who help us out here, including masters in social work, masters in counseling and guidance, and masters in family therapy. We've been very lucky in the last year to add psychiatric staff as well. We have a psychiatrist here, as well as a psychiatric nurse practitioner, both of whom work very actively with our clients to prescribe and manage medication. We also have a psychologist who helps us out with our assessment and psychological testing process, who's been terrific so that we can turn around those assessments more quickly. So we have a full service team here to serve you. Work that you'll get done here will be thorough, will be complete. We will answer your questions, and we'll be sure that when we propose treatment, you know why we're doing it, and that you're clear about what we expect to happen as a result of the process. So ADHD is an important thing, and we're seeing a lot of kids with it. So we hope that you'll think about us if you're interested in having your child evaluated, and that you'll consider coming in and working with us here at Western Wisconsin Health. Thanks very much for joining us today. If you want to learn more about anything I've talked about today, please visit our website at www.health.org, and there you'll find all kinds of information about our programs here. Thanks for joining us.